Now, last examination is the examination of the liver, the special organ examination. In the past, we do not give the liver his importance, or we do not pay much attention to examination of the liver, but now it is very important, because in cases of malignant lesions, as pancreatic head malignant masses or even gastric malignancy, there may be very minute hepatic deposits not seen by CT or MRI, few millimeters. So it is very important to examine the liver, searching for metastasis, because of course it will change the management of these patients. I prefer to start examination from the liver at the cardia, but here my landmark is not the abdominal aorta. It is a uppermost part of the inferior vena cava at its entry with the right atrium. So I locate the echo endoscope, the tip of the echo endoscope, the probe of the echo endoscope at the cardia, and start to do just below the cardia, and just start to do clockwise and anti-clockwise rotation. If I find my landmark, it is okay. If I find the abdominal aorta, as in station 4, I can do anti-clockwise rotation 90 degree, and I'll find this landmark, which is the inferior vena cava. And this is the intrahepatic part of the inferior vena cava. And this is the biggest tributary of the inferior vena cava, which is the right hepatic vein. The right hepatic vein can be recognized by the following character. It has the widest diameter at its joining part with the inferior vena cava. And then there is gradual tapering of the right hepatic vein. So this is the widest diameter, and here this is the narrowest diameter, and there is gradual tapering. Opposite to the middle hepatic vein, which has a homogeneous diameter all over. Let us see this video. Yes, this is the inferior vena cava, and this is the right hepatic vein, very nicely. Wide from here and narrow. Here, and this is the left portal vein, left branch of the portal vein. So this is the inferior vena cava, intrahepatic portion of the inferior vena cava, and the right hepatic vein. Here, the segment in between the echo endoscope and the right hepatic vein is the segment 1, which is the caudate lobe. And here, this is the segment between the inferior vena cava and the right hepatic vein is segment 8, and this is segment 7. So segment 1, caudate lobe, 8, 7, 1, 8, 7. And expecting that 8 here, it will be 5, and this is 7, expecting here that it will be segment 6. So 1, 8, 5, 7, 6. Let us continue. Yes, this is the right hepatic vein. Here, after visualizing this segment, I will start to do anti-clockwise rotation. Anti-clockwise rotation. Yes, this is a venous structure, and I will now start to do anti-clockwise rotation. Anti-clockwise rotation. Still, this is the right hepatic, and this is the left portal. Yes, very nice. I did anti-clockwise rotation, and here this is a very long vein, is the middle hepatic vein, and as you see, the diameter is homogeneous all over, the same diameter all over the whole length of the vein. And here we notice that there is a fibrous ligament, which is the ligamentum venosum. Ligamentum venosum communicating the left, embryologically communicating the left hepatic, the left portal vein, communicating the left portal vein with the inferior vena cava. Embryologically, this is embryologically fibrous ligament inside the liver communicating the left portal with the inferior vena cava. And this is the middle hepatic vein. So there are 3 segments here. Segment 1, the caudate lobe, in between the echo endoscope and the ligamentum venosum. And segment 4A, in between the ligamentum venosum and the middle hepatic vein, and segment 8. So this is 1, 4, 8. 1, 4, 8. Inferior vena cava, ligamentum venosum, left portal vein, middle hepatic vein, and segment 1, 4A, 8. Then let us continue. Yes, this is very well in ligament, ligamentum venosus. And then I will do more and more anti-clockwise rotation to see the left hepatic vein. To see the left hepatic vein. Yes, this is very well nicely seen left hepatic vein. Yes, this is the left hepatic vein. And this is segment 2 and segment 3. And segment 2 here, the segment which we can do hepaticogastrostomy. This is segment 2. And segment 3 and the left hepatic vein. So we'll start very easy from the inferior vena cava at its junction with the left, at its junction with the, right atrium. And then by then we will see the intrahepatic portion of the inferior vena cava and the right hepatic vein. And then more and more anti-clockwise rotation. We see the middle hepatic vein, more and more anti-clockwise rotation. We can see the left hepatic vein. Let us, this is the last slide or the last video. Let us repeat what I have mentioned and also mentioning the fish eye appearance. Let us see this video. Now you are very oriented with this picture. This is what structure? Yes, the inferior vena cava. And this is the intrahepatic portion of the inferior vena cava, yes. And what this structure, which begins wide, broad, and gradually tapering, this is the right hepatic vein. And what is this segment in between the echo endoscope and the inferior vena cava? Yes, this is the caudate lobe segment 1, right. And this segment is 8, and this segment is 7. 1, 8, 7. Let us continue. Yes, 1, 8, 7. IVC right hepatic vein. Then I will start to do anti-clockwise rotation. Anti-clockwise rotation. Yes, anti-clockwise rotation. Still, this is the right hepatic. And see, yes, starting to appear the middle hepatic vein. Anti-clockwise, anti-clockwise. Yes, I starting now doing anti-clockwise rotation. Yes, very nicely seen. This is the middle hepatic vein. A very long vein with homogeneous diameter all over its whole length. And this is the left portal vein. And here, this is the ligamentum venosum communicating the left hepatic vein to the inferior vena cava. So these segments are caudate lobe 1, 4A, and 8. Okay. Let us continue. Here I will do more and anti-clockwise rotation to see the left hepatic vein and segments 2 and 3. But here in that video I will do something more. I will push the echo endoscope forward. This is the middle hepatic vein still. Yes, and more anti-clockwise rotation. More and more anti-clockwise rotation. I think this is still the middle hepatic vein. And more anti-clockwise rotation. Yes, this is the left hepatic vein and segment 2 and 3. Here I will do more examination of the liver. This is the left hepatic, left portal vein. Left portal vein, and this is the ligamentum teres. I will push the endoscope inside to centralize the left portal vein in the middle of the screen. Yes, I will do push the echo endoscope downwards. I will push it inside the patient in order to visualize the fish eye appearance by pushing the echo endoscope downwards and starting to do clockwise and anti-clockwise rotation. Yes, starting to appear the left portal vein and the fish eye appearance, like the eye of the fish. Yes, I am tracing this structure, trying to locate the fish eye. Yes, this is very nicely seen fish eye appearance. Yes, this is very nicely seen fish eye appearance. Yes, This is the left portal vein and fish eye appearance. At the fish eye appearance, the left portal vein, I mentioned before several times that there is a ligament, ligamentum venosum, communicating the left portal to the inferior vena cava. And on the other side, to the right of the screen, to the opposite side of the, sorry, this is the right of the screen, to the left of the screen, this is the ligamentum teres. So this is the fish eye appearance, and to the right of the screen is the ligamentum venosum, going to the inferior vena cava, and here is the ligamentum teres. Here the level segments are at the level of the fish eye appearance. This is 4A and this is 4B. At the level of the ligamentum teres, this is segment 3, and here at this position we can do hepatogastrostomy in segment 3, and this is 4B. And at the level of the ligamentum venosum, as I told you before, this is segment 1, caudate lobe, and this is segment 4B. So this is 4B, 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 and this is segment 3, 4A, and 1. 3, 4A, 1, and 4B, 4B, 4B. This is the fish eye appearance. Now this is the last slide of the liver. We mentioned nearly the whole segment. At the right, at the level of the right hepatic vein, I can see 1, 8, 7. And at the level of the middle hepatic vein, I can see 1, 4B, and 8. At the level of the portal, at the left hepatic, I can see 2 and 3. But 5 and 6, till now, we didn't see 5 and 6. We can saw it in the bulb of the duodenum at 9 o'clock. So we should do anti-clockwise rotation to look at 9 o'clock, or in the antrum, in the pre-pyloric region, and also anti-clockwise rotation to locate at 9 o'clock. I can see here the gallbladder very nicely. And this is the fundus of the gallbladder, and this is the neck of the gallbladder. The part of the liver at the fundus of the gallbladder is segment 6, and the part at the neck of the gallbladder is segment 5. So this is segment 6 and segment 5, the gallbladder, the fundus of the gallbladder, and the neck of the gallbladder, segment 5 and segment 6. So we saw all segments of the liver, 1, 2, 3, 4A and 4B, 5 and 6 as the level of the gallbladder, and 7 and 8 as I told you before. So it is very important to examine the liver, and we are now running a multi-center study, a big multi-center study of examining thoroughly the liver in cases of malignant intra-abdominal malignancy, especially pancreatic malignancy, GI malignancy, esophageal, gastric, and duodenal, and searching for minute liver metastases not seen by CT or MRI. Now we finished our webinar. I hope that I delivered some messages in linear EUS examination to arrange ourselves in order to visualize most of the intra-abdominal structures. Now take-home messages. There are 4 main stations seen from the stomach and the duodenum, in addition to the mediastinum and through the esophagus. You can start from below upwards, start from station 1 to 4, or the opposite. You can start from station 4, then 3, then 2, then 8. And the best way of EUS examination is the way you are used to do and perfect. But whether you start from below upwards or from above downwards, in each station, try to identify the anatomical structures and landmarks.